Morgan County Rural Training Track was very much developed out of a need for primary care providers in rural areas.
What I want to do is train residents that they're able to take care of my family members. If you're a good enough doctor for my mom or my wife or me or my children, then you're a good enough doctor. And we have a unique combination of an academic university medical center and then real-world rural practice. So we really have the best of both worlds.
Get the opportunity to train at the University of Colorado, which is one of the top family medicine departments in the nation. Our residents have the opportunity to work with some of the leaders in family medicine, have exposure to top-level specialists in all areas. Then they get to take all of that they learned in their first year, maintain all of those ties with the specialists and the faculty in Denver, and bring it out to Fort Morgan, where they get to apply it in an area with fewer resources and really an area where there's so much need.
We're a small community. We're about a population of about 11,000. We are the second most diverse city in Colorado.
So I decided to stay on as faculty in Fort Morgan. I think coming in as the first class of the rural track, I had a lot of say in the structuring of the track, and I felt like my work here wasn't done and I'd like to continue that.
Here you get a very customized and tailored experience to what you want to accomplish out of your 3 years of residency training. You tend to have lots of hands-on experience.
There's no competition for our attention as they literally sit right next to us at the desk. I enjoy just being able to turn over cases to them, as allowing them to be the first primary physician seeing a case, running things by me.
I've seen, farm injuries, all manner of car accidents, adrenal tumors, all sorts of cancers, gastric cancer. So you will get a chance to see that even in a small area. If they're in their clinic and they diagnose something that's a surgical problem and they want to follow that patient into the operating room, you have a unique opportunity in a setting like this that you wouldn't get if you were in a tertiary referral center in a big city to go in and scrub into the case.
All the attendings know each other very well. There's a lot of opportunities for you to get procedures as well as that direct experience that is so important with becoming a future attending yourself.
We have a very strong ER rotation. We have a level 3 trauma center, which is the highest in the county. This allows our residents to see a lot of trauma, anything from farm accidents to lots of motor vehicle accidents, since we're right off the highway.
The residents spend 1 month doing a geriatrics rotation with me at the nursing home. There we see long-term care patients who are here with dementia or other chronic debilitating diseases. We also see acute rehab patients who are recovering from an injury or fracture repair or stroke or the like. The opportunities in the nursing home are great for working on relationships and sort of diving in depth to some of the more social aspects of medicine, and especially with elder care and geriatric care. It's a little bit different pace and we're not so rushed here.
The training in Fort Morgan for the Continuity Clinic is at Salud. We provide cradle-to-grave services, so prenatal all the way through pediatrics, adult and geriatric medicine. And our mission is to provide high-quality care to every patient that walks through our doors. We are a federally qualified health center. We are really dedicated to providing the highest quality care in this community health setting.
There's a great support system and a great medical assistant staff that will help you throughout all of your visits and all the things that you need to accomplish for your patients and yourself while you're in the clinic.
I like the opportunity to work in a federally qualified health center in a diverse community and work with underserved patients, and it's been a great experience.
In Fort Morgan, we are the second most diverse community in Colorado. This is pretty unique for a rural area. So our residents have the opportunity to work with a wide variety of patients.
I would say my own personal patient panel includes a large diverse population, and with many different languages spoken.
We have these people at the beef plant from all over the world, and so there's tropical medicine involved, and there's all sorts of things that happen that you're just shocked. You say, I read about this, never thought I was going to see it.
Also, I've just been able to reach out to different groups in the community and kind of work with them and talk with them and kind of determine how we can make Morgan County better as far as health and equity.
So having residents come here and get a feel for what it's really like to be a family rural doc in a diverse community, this is going to be where you're going to get your experience.
One thing I really love about Fort Morgan and Morgan County, especially for me, are the connections. It's not uncommon for me to meet patients who were patients of my grandfathers many years ago, or that my dad even delivered, and to have those relationships and those connections with my patients is really meaningful.
One thing to know about Morgan County itself is that you are really not sacrificing anything out of being in a big city. All the amenities that you need are all local and here. There's quite a different activities that you can do over here and different events that go on all year long. And one advantage of being in Morgan County also is that if you are a city person and would like to go back and forth to the city, you know, the city is just like an hour drive away.
We want to have you here. We enjoy just the stimulation that comes from having a resident chiming in, bringing maybe new ideas to us, challenging us to be on our toes.
We are excited for the opportunity to meet you if you want to interview with our program.
Come to the University of Colorado Morgan County Rural Training Track because you will get the best of both worlds and come out ready to be an excellent family physician in a rural area or wherever you plan to practice.